Good morning. Again, I'm Michelle Corson. I'm the Public Relations Officer with Kern County Public Health. We have a lot of concern, obviously, about the novel coronavirus, which we're calling COVID-19. Over the weekend, there were lots of developments, so understandably, our community has a lot of questions. So I just wanted to kind of come together today and let you know where we stand right now in Kern County, and some of the actions that we have taken. So let me just start by saying that we continue to monitor this very fast evolving situation. Our department is in regular and ongoing daily communications with the Centers for Disease Control and the California Department of Public Health, receiving guidance and updates which frankly are rapidly coming and ever changing. Currently, there are no confirmed cases of the novel coronavirus in Kern County, and the immediate health risk remains low for the general public. There have been 43 cases of COVID-19 confirmed in the United States, and an additional 47 have been identified in persons that have returned and were through the Wuhan, China, and the Diamond Princess cruise ship. So kind of two different types of cases that we've been dealing with. What is new and what changed over the weekend is that the first case of COVID-19 in a healthcare worker occurred in Washington, and the first possible outbreak in a long-term care facility were reported in Washington. And additionally, there has been confirmed 2 deaths in Washington, which is the first 2 deaths in the United States from COVID-19. Again, all of this has occurred in Washington. The CDC has come out and they are stating that we are likely to see more cases and in the coming days, and that person-to-person spread will continue to occur globally. Another thing we really want to remind our community about, the travel advisories and restrictions completely continue to change. I think they're going to be even announcing some new things today. So we're really advising residents to watch where these restrictions are going. The Centers for Disease Control has a fantastic website, and we really want our community to stay up to date by visiting that website, and more importantly, visiting our website. So let me get into a few things quickly that we have done here at Public Health, and then I'm going to open it up for questions. The actions that we have taken, and this has been happening over the last several weeks here in Kern County, we have implemented the emergency medical service dispatch protocols to assess 911 calls for potential symptoms of COVID-19 and exposure history. This provides notification of a potential case so that first responders are aware before that initial face-to-face contact with the patient. We have launched an internal public health task force, and so it is something that we are fully prepared. We want to be able to provide guidance to first responders and the community as this evolves. Really importantly, we have developed a local website, and we've just updated it today. So visit kernpublichealth.com, and this is where we're going to continue to provide ongoing, up-to-date information for the community. And it also provides really fantastic links to the CDC and the Centers for Disease Control. We are issuing routine, detailed recommendations to our local health care providers. We have implemented the CDC monitoring program for returning international travelers. As of today, we have received 13 names of international travelers that we are assessing on whether or not they fit the criteria for being monitored. And if they fit the criteria, that is something that our staff is working on. We have implemented ongoing collaboration, obviously, with our local media partners, and we want to continue to hold now weekly updates so that we can get the message out in a timely fashion. We finally are working with hospitals, healthcare providers, schools, college campuses, local businesses, county departments, law enforcement, and corrections. These meetings are happening. They're happening all week. The communications have been ongoing as our community really kind of brings the preparations that we've all been making over the course of the last several weeks. We're just continuing to get ready for the potential spread of a respiratory illness such as COVID-19. And the final thing that I would like to say is there's lots of calls and rumors that there are cases in local hospitals. That is not the case. There are no confirmed cases. But what I will say is we have begun testing. Testing kits have become available. This is a way to quickly identify any potential cases. So we are currently testing 2 residents for coronavirus. They are considered low risk. The criteria was just expanded for individuals that we could test since Friday, actually. So these are individuals that, again, are very low risk, and out of an abundance of caution with the new criteria, we are now testing 2 individuals. I won't say where these individuals are, but they are in isolation, and the proper protocols that the CDC has put forth are obviously being implemented. So I think that we can expect more testing to happen over the next days and weeks, as this is just one of those things. If we can identify the cases, we can quickly isolate and take the proper precautions. So I want to end with opening up for questions, obviously, but for our general public, the risk remains low. 80% of the known cases are mild, and it seems so far what we know about the novel coronavirus, it is infecting, or it is impacting those that are older and have compromised immune systems, very similar to the seasonal flu. The risk does remain low in our community and in the United States. So with that, I'll entertain questions.
Are these ones that you're testing, are they in a hospital in Kern County? Can you say that?
I won't confirm where they are, but they are in isolation.
What are the new criteria that have just been expanded for testing?
So it went from the initial criteria, and it's been so quickly changing. Initially, it was if you had a travel history to China or you yourself had come into a positive case of COVID-19. It now has been expanded to truly a series, and it can be found online, but it will include if you have a respiratory illness and you don't have a known cause of that illness, then those are individuals that can be opened up to testing. So there are protocols that all of our hospitals and healthcare providers are following, and the guidelines are on CDC, but it has been opened up not just to a travel history, but if you are showing these symptoms and they can't find a reason why, you now can be tested.
And how does COVID-19 manifest itself any differently than the flu?
That's a great question. There's still a lot to be learned. The symptoms are very similar. What we are saying about what is the definite symptoms to be looking for in COVID-19 is cough, fever, shortness of breath. So, of course, those are also things you can be experiencing with the common cold or the flu. But those are the specific things we are asking people to pay attention to. We also don't want people to, overreact. And like I said, 80% of these cases are going to be mild and resolve on their own. So it's a reminder, whether it's the flu or the cold or potential COVID-19, stay home if you're sick. Stay home if you're sick. Take the precautions every day to protect yourselves during flu season. We cannot reiterate that enough. Hand washing, avoiding others that are sick. These are all really important. The surfaces you touch, avoid touching your face. So today as you come through here and you're touching doorknobs and all the things that we touch, don't touch your face without knowing you have clean hands, things like that.
Are masks actually useful in prevention?
Absolutely, masks are important for our healthcare workers. For the general public, the Centers for Disease Control is being really clear about this. It is not recommended to be of any assistance for our general public. If you are in healthcare or you yourself are impacted with COVID-19, those are the cases that the masks would be recommended and helpful.
Michelle, I have a question. What prompted you to test these two residents for coronavirus?
They met the new criteria for expanded testing. So without getting into the details, which frankly I personally don't know, they have to meet this criteria. So whether it's a travel history and symptoms, or symptoms that won't resolve and fit the criteria, and they have not found the source of the illness, those individuals can now be tested. So it will not be uncommon that this testing is going to increase. And so in the coming days and weeks, we are going to find a way to regularly report this out. It will be changing every day. The one thing we will let our community know is if and when this were to come to our community, and if there was a positive case identified, we are going to let our residents know.
So you can't say if these two individuals traveled to China or were in contact with somebody else who may have been exposed to the coronavirus?
No, I don't know. What I do know is they only became eligible when the criteria was expanded, which indicates they themselves did not have a travel history.
So when did the testing start? Today?
Over the weekend.
And when you say they're in isolation, does that necessarily mean they're in a hospital setting?
I'll go ahead and say yes. I just won't say where.
So they are in a hospital?
Yes.
Well, we've gotten several calls that supposedly it's Memorial Hospital and that workers are concerned there. What would you say to workers in Memorial Hospital who are afraid for their own safety because you know how rumors go and how these things can go?
I would say, first of all, we have a fantastic healthcare system in America. Here in Kern County, it is exceptional. And we have been preparing this. Hospitals prepare for this. We are not in a shortage of PPE for hospitals and first responders at all right now. So they are trained to handle not just cases of potentially COVID-19, but any other infectious types of diseases. So to follow their hospital protocols and to express any concerns they may have with their management is what I would say. But again, it is to be taken seriously. These protocols are in place for a reason, and that's why we are having ongoing communications with our hospitals and healthcare facilities. The Centers for Disease Control are bringing down protocols as we speak to help empower them and so that they're implementing the proper precautions. So again, it is to be taken seriously, obviously, but we need to remember what it is we're dealing with and what we know COVID-19 to be. And there is no reason to think that it would be any more dangerous than the seasonal flu, which we have been equipped to operate under those conditions for years now in healthcare facilities.
And when do you think you may get the results whether these two individuals have the coronavirus or not?
I don't know. It's unknown. I will be able to tell you we are not conducting tests here. This is an evolving situation, so we have to submit our samples to the California Department of Public Health. So for us, that's going to be a regular pattern. Again, where the testing will evolve throughout the state is ongoing.
So just so that I'm clear, so these two individuals being tested, they're actually you're gathering samples or whatever it is that you gather, and you're sending them off to Sacramento?
Correct.
California Department of Public
Correct.
Health? And they're doing the actual testing?
Yes.
Okay. And then they'll let you know if there's
Yes. Yes.
On your Kern Public Health, KernPublicHealth.com, that's the website that people can get on. Is that also available in Spanish?
Many of the materials that we're putting up, any of the flyers that we're putting up, yes, are going to be are in Spanish currently. And also we are starting to utilize and reproduce a lot of the Centers for Disease Control. All of those are in Spanish as well. So we are also doing robust social media, and we're putting out the Spanish resources on our social media sites. But if you visit our website right now, we have an infographic and an FAQ in there, both in English and Spanish.
And this Public Health Task Force, can you expand on that? What's it about?
So that's just a group that is going to include myself and the communications team, as well as members of our epidemiology team and our emergency medical services. We're just a dedicated group where this is now what we're focusing on, so we can move quickly and be nimble for our community as these protocols come down the pike, and we can quickly distribute those. It's all hands on deck for us. This is public health's purpose. This is what we do. We work to protect the health of our community, and we take it very seriously. So there's a lot of busy folks around here, and there's a lot of exceptional individuals that work here and really dedicate their lives to this work.
What work, if any, is public health doing with the mission?
The mission.
The mission at Kern County.
Oh, we've got so many meetings lined up. I don't know that we've met with them directly. We are meeting with the homeless shelter this week, for example. So there are protocols in place, and we have been doing some emails and sending things out. I can't specifically say if we've directly dealt with them as of now, but we hope to if we haven't already.
And just going back, you mentioned that you received 13 names of international travelers to look out for. Are these people that are soon to be arriving here in Kern County?
So let me explain that. It's been in the last couple of weeks, the protocols that were set in place for travelers that had, at that time, if their itinerary had touched China, they were being funneled through one of 11 airports here in the United States, where those people were being screened by Border Patrol, and if they were symptomatic, they were keeping them there and doing mandatory isolation. If they were not symptomatic, they were able to come home. Those names were passed to the California Department of Public Health and then down to the local health jurisdictions so that we could follow up with those travelers to make sure that they were not symptomatic and make sure that within that 14-day period would not develop symptoms. So we would monitor them daily, taking temperatures, things like that. So this has been an evolving number that as of today, we have received 13 of those names. Most of them have come off of the list and are no longer being monitored. I don't have a specific amount for you today. None of those 13 have been actually tested.
So they're already here,
Yes.
and they've traveled at some point to China in the last 14 days?
Yes, that was the criteria. Now, this criteria may be changing soon, but that is the criteria for monitoring travelers that we had been using, is if their itinerary had touched China.